Good evening. We are live at 7 o'clock. I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Glen Cove Hospital to help you sort through what's going on with COVID-19 in our communities and across the region. And we want to hear from you. Call us at the number at the bottom of your screen, live, 516-393-1800. All right, let's get to the numbers. That virus now is confirmed in every state. 118 deaths nationwide, 20 of those right here in the state. Now here's an update on the latest numbers for the pandemic. There are now more than 2,300 confirmed cases in New York, at least 278 confirmed in Nassau County, 152 in Suffolk. And a second drive-through testing site on Long Island opened up today, this one at Stony Brook in Suffolk. The Jones Beach mobile site in Nassau also up and running. Both do require appointments ahead of time. You have to call the state hotline, not the county one. This afternoon, Governor Cuomo mandated that half of all workers must stay home to stop the spread of the coronavirus. It's all part of some drastic efforts taken by the state to reduce the number of people exposed. The governor also announced the deployment of a 1,000-bed Navy hospital ship. It comes to New York Harbor to treat coronavirus patients. And a second ship that will be deployed to the West Coast. And today, President Trump announced the Housing and Urban Development Department will suspend foreclosures and evictions through April. It's part of a growing number of Americans facing the losing jobs and missing rent and mortgage payments. Okay. Let's get to our discussion right now. Joining us tonight is Dr. Payal Sud. She is the Associate Chair of Emergency Medicine at Glen Cove Hospital. Doctor, thank you for your time. I know you're coming off a 12-hour shift. We appreciate you giving this public service for the community in Long Island.
Of course, I'm happy to be here.
Well, let me ask you first. You say you're coming off a 12-hour shift. You know this is important. You're in ground zero. What are you seeing? Are you seeing a lot of patients coming in fearing that they have COVID-19?
Absolutely. We're seeing a lot of patients that either are fearing that they have it or with symptoms similar to COVID-19 symptoms. But at the same time, you have to remember we're a busy emergency department and we're seeing patients coming in with all the other emergencies that they were coming in with before. So it's a combination of both.
Okay, let's go right to the phones right now. I think we have Rita at Setauket. Rita, you there?
Hi, yes, I am. How are you?
Thanks for calling, and what's your question?
Hi, doctor. How are you doing? Thank you for everything. So I'm just over 30 weeks pregnant, and I would like to know if I'm considered any women who are pregnant considered vulnerable, like the elderly, and if in the event a pregnant woman would contract the virus, if there's any information as to how the virus may affect the fetus.
Dr.
That's a great question. So as a lot of you guys have realized, this is a new virus, which means that we're constantly learning more and more about it. Up until right now, unfortunately, we don't have a lot of good information about what exactly happens during pregnancy and how it affects the fetus. That being said, in most diseases, pregnant women are considered what we call a vulnerable population because not only is your immune system a little suppressed during pregnancy, but also you're nurturing a fetus, a baby in you. So I would suggest you should be extra careful compared to a lot of people out there to make sure that you're staying safe away from anybody with respiratory symptoms. The most important thing that you can do is good hand washing. That's the #1 way anyone can stay safe from this virus in the community.
Okay, let's go back to the phones. Phyllis from Comac. Phyllis, what's your question?
Hi. So I would like to know how long after a person actually contracts COVID-19 and is asymptomatic does the test accurately detect a positive result? For example, if I was exposed on Monday and actually contracted the virus, will the test be positive on Tuesday?
That's a great question. Doctor?
Thank you.
Another excellent question. So we do know that the incubation period for the virus, which means the amount of time that it takes for you to get symptoms after being exposed to the virus, is anywhere between 1 to 14 days. Now, when will the test actually become positive? Again, not a lot of accurate data out there, but we definitely have seen patients coming in with a day of symptoms being positive. You've seen patients coming in with symptoms going on for longer coming in positive.
Yeah, and sometimes you don't know when you were actually infected.
Exactly.
So,
because a lot of the symptoms that this virus presents with are actually quite vague in this season. You know, the runny nose and the cough and the fever. We see that with so many different things. So it's really hard to say, as you mentioned, exactly pinpoint when the symptoms of COVID-19 in particular commenced.
Right. Okay. Meg from Long Beach. Meg, are you there? Meg, are you there?
Hello?
Is this Meg from Long Beach?
No, this
is David from Ronkonkoma.
Ronkonkoma.
David, go ahead. What's your question tonight?
Hey, what's going on, Doctor? Thank you for taking some time out of your day to answering my question. My question is, what are the long-lasting effects of the coronavirus?
So did you ask the long-lasting effects? I'm sorry, I couldn't hear you well.
Yeah, what are the long-lasting effects?
So it's hard to say exactly now because, as the name suggests, COVID-19, this was just discovered in 2019, and the first case being reported in December 2019. We haven't seen patients have had this virus long enough to see what the long-lasting effects, such as, and by long-lasting, I assume you're saying months, years down the line. We just haven't had any patients that have gotten to that point yet because we're only in month 3 or 4 of seeing patients with this virus. So I think time's going to tell what happens over a longer period of time.
Now, hasn't there been some cases where people are at least fearing in Asia that they've had some kind of lasting lung capacity effects?
There have been some reports, you're right, saying that, but again, I hesitate to use the term lasting because it hasn't been that long since the virus has been out there. Yeah. So maybe lasting for 3 months, but does that mean they'll gain full recovery by 6 months, a year? Hard to say yet because we're just not at that mark yet.
Yeah, all right. Back to the phones. This time, I think Meg is here now. Meg from Long Beach, are you there?
I'm here.
What's your question tonight? Thanks for calling.
I have two, actually. The first is we're hearing that we may have the coronavirus and not know it. Are scientists developing a test to see if people already have the antibodies to the virus, and can you get sick from it again?
Excellent questions. So the first question was, are scientists developing tests to see if we're developing antibodies to the virus? I'm not 100% sure where we are with that kind of testing, but yes, that is one of the things that scientists are working on. Again, I don't know exactly what the status is on that, because right now, clinically, what we're focused on is detecting the virus in patients that are symptomatic from it. And what was your second question again?
Maggie,
well, I was wondering if you could get sick again, but I had a totally different second question. Was that I'd heard there are 2 substrains of the virus, and one might make you sicker than the other. I read something about this a couple weeks ago. Is there any truth to that?
So right now, our tests are as sophisticated as just generally detecting whether you have the virus or not. So far, our tests have not been speciating exactly what type of virus we're seeing. Again, this is very new, so only time will tell exactly what we find in terms of the different subtypes of this. What we do know is this virus belongs to the human coronavirus family, which is the same family of viruses that caused SARS back in 2003 and MERS back in 2014, and the other coronaviruses that cause the common colds in younger children. So it's all that same group of viruses that this virus actually belongs to.
So, Doctor, let me ask you this. We have a Navy ship headed to New York Harbor. Our cases seem to be spiking. Well, that's coming with increased testing. Are we equipped right now? Is our health infrastructure equipped for even a moderate pandemic sweeping across the state?
So the number of cases, as you mentioned, are certainly going up very fast. Not only because this virus is spread very easily, but also, like you mentioned, we're testing more people. So that denominator of the number of people affected is increasing. And I know across multiple health systems across New York, especially at Northwell, we're constantly gearing to make sure that we're here to protect our community. Every single day, we have huddles with the leadership for all the 18 different emergency departments across Northwell to ensure that we're following the highest degree of protection and standard for our healthcare workers and for our patients to gear up and get ready for when the surge gets worse. We have multiple plans in place across the different sites to better suit each community that each of our site is located in, to ensure that we can handle the kind of pandemic that we're fearing, that we're expecting.
Okay.
So, yeah, go ahead.
No, you go ahead. You're finishing your thought.
No, so we'll see. The biggest thing, I guess, one of the biggest concerns is not only are we seeing, as I mentioned earlier, some patients coming in who are pretty sick from the virus, patients coming in with the usual gamut of things we see in the emergency departments and in the hospitals, such as heart attacks, strokes, accidents, whatnot. But we're also seeing a huge influx of patients coming in that are actually not that sick from the virus. And in order to kind of curb this pandemic overflowing in our emergency departments and in our hospitals so that we can prevent the overwhelming of our healthcare system, I know multiple other medical experts would strongly recommend that if you're not that sick from the virus, if you're able to breathe well, able to control your fever with over-the-counter Tylenol, please stay home. Okay. Coming to the hospital, you're exposing yourself and others to catching worse diseases. So as much as we can get the well people home, that way we can have our resources available to take care of the ones that truly need us.
Okay, let's try to squeeze one more question in here. Susan from Port Jeff.
Yes, hi. We're curious. We're hearing that there's a shortage of blood supply, and we're encouraged to donate. However, is the COVID-19 transmissible in a blood transfusion? Are they testing for that as they do other viruses?
So that's interesting. I have not heard about needing blood supply for COVID-19. Is that what you're asking?
Yes. If it would be transmissible in the blood supply, as in other viruses that they test for in the blood supply.
Like an autoimmune.
Got it. So usually when we give blood to a patient who needs it, the blood is tested over and over again, very, very thoroughly in the lab to ensure that no transmissible diseases are going forth in that. I'm not exactly sure what the specific tests are to look for COVID-19 in a blood transfusion, but the blood is thoroughly screened before it's given to anyone.
All right, now we're going to take a quick break, Doctor, and we're going to have more expert advice on how to keep you and your family safe from the coronavirus. And remember, we want to hear from you. Call us now with your questions, 516-393-1800. We'll be right back. Welcome back to our live coronavirus pandemic special report. Now remember, we want to hear from you, so call us now with your questions at the number right there at the bottom of your screen, 516-393-1800. Let's bring the doctor back in, Dr. Payal Sud. She's the Associate Chair of Emergency Medicine at Glen Cove Hospital, coming off a 12-hour shift, still taking the time to answer your questions, so we appreciate that very much. Let's go back to the phone lines right now. Paulette from Rocky Point. Paulette, you there?
Yes, I am.
Thanks for your calling, and what's your question?
My question is there any risk of contamination involved in using the washing machines and dryers in a laundromat?
Very good question.
That's a very good question. So there is a risk that the virus can survive on inanimate objects and surfaces. And so if someone has been diagnosed with COVID-19 or is being ruled out for COVID-19, one of the biggest thing that we recommend is that 14-day quarantine. And the reason that's recommended is to ensure that everything that they do, the food that they're eating, their laundry, their toiletry needs, and all of that are handled separately and don't mix with anybody else in the household. So that being said, if everybody in good conscience, being a good citizen, is adhering to that, and if they're COVID positive, they're staying home and not using the laundromat, then that's great. Then we're all safe. But not knowing that, it's hard to say.
So Doctor, let me follow up on that question. Does the health community have any idea, even speculation, as to how long, if the virus is sitting on a surface, how long before it's not pathogenic?
So the different, again, like I said earlier, this is still a very new virus, so we're still learning a lot of things. From different reports that I've read, it's been anywhere between 12 to 24 hours that the virus can stay. The exact amount of time, I don't think we know for sure yet.
Okay, let's go back to the phone lines. Michelle from Eastport. Michelle, you there? What's your question?
I sure am. My children traveled with us and our grandchildren out to California. We came back at the end of January, and my grandchildren presented with symptoms of upper respiratory, lots of coughing, fever. They went to their pediatrician. They were tested for strep. They were tested for other things, and the doctor said it's just some upper respiratory virus. Go home and do your typical treatment. Is there any way to determine if at that point, now they are asymptomatic, of course, but if at that point they did contract the virus?
Is there any way to tell now? Is that what you're asking?
Yes. Is there any testing to determine if someone previously had the virus?
I see. So these symptoms, if I'm understanding you correctly, were about a month and a half ago. So
yeah, the end of January.
Yeah. So unfortunately, at this time, we wouldn't be able to tell if the virus was present a month and a half ago. Regardless, if they've recovered now, even if they were positive or negative, it's really not going to change much at this point because they're doing better.
Okay, let's go back to the phone lines. Benjamin from Bellport. Benjamin, you there?
Yes, I'm here.
Thanks for calling. What's your question?
Thank you. Me and my wife, Catherine, would like to know, because we watch the news a lot with our children. There was a case of a gentleman who was sick with corona, but they gave him the antidote for Ebola, which he recovered. Is that true?
They gave him what?
They gave him the antidote for Ebola, the serum for Ebola to cure Ebola, which it didn't help for the Ebola virus, but it's helping for corona, supposedly. I've heard that in the news, and I also Googled it, and they said that it was experimental.
Right. So because this virus is so new, there are no definite therapies that we know of yet. From all the reports coming from multiple different countries now, we're all constantly studying these reports and actually trying all of these, as you say, experimental, but that's what we have now. Experimental and case reports, that means reports of patients, like you mentioned, recovering from certain therapies. We are trying those on patients, and we have had some patients recover. So again, this is all very new, so I think only time will tell which of these therapies are going to end up being successful.
So doctor, let me ask you this follow-up on that. What advice do you give people as far as when they should call in? What symptoms should we be looking for in ourselves?
That's a great question. So the three main symptoms that we talk about this virus presents with are fever, cough, usually a dry cough, and shortness of breath. So if you're having any of these symptoms and that you're concerned that you might be exposed to the virus, which in reality now, unfortunately in New York, that's anyone who's going outside, your first call should be to your primary care doctor to talk to them and get their advice. If you're having trouble breathing and you're not doing well, definitely the emergency department's the place you want to be. Calling ahead of time to the emergency department you want to go in will help us prep and get ready. That way, the moment you come in, I mean, all the departments now are taking extreme caution, isolating the patients. We're putting masks on all the patients and the visitors and the staff members to prevent the spread of this virus. But if you've called in ahead of time and we know your name, then the moment you come in, we can immediately take you to kind of a warded off area. We have special areas.
I don't want to cut you off right there. I'll let you finish that thought. We're going to have to take a real quick break. You're watching our coronavirus pandemic special report. We'll be right back. Welcome back to our live coronavirus pandemic special report. Now, we just have a few minutes left. Dr. Sud, I cut you off there at the end when you were finishing your thought. I'm going to let you finish that thought. And then if you could follow up on that, what's your advice just generally for the public?
So the biggest piece of advice I could give now, I think, to all of New York is follow the recommendation to stay home. Avoid large gatherings. Do not get into big groups right now. If you're feeling sick, please, please, please stay home. Feel free to call your primary care doctor to get advice. And most importantly, wash your hands. Wash your hands with soap and water for at least 20 seconds. You know, the way I tell my kids, my first grader and my third grader are saying happy birthday twice. That's how you should be washing your hands. And if you don't have soap and water with you, use hand sanitizer, but make sure that has at least 60% alcohol in it. And that's the biggest thing, you know, no large groups, stay in as much as possible, call your doctor for advice, and good hand hygiene.
Well, we appreciate your time. I know you're coming off a long shift. Thank you very much. Dr. Payal Sud of Glen Cove Hospital. And to our viewers who called in, thank you very much. I'm Stone Grissom. Good night.